I think that driving healthy change is something that's just part of medicine. When you decide to go into this field, I feel like you take on the responsibility of being a change maker and being able to lead the charge. So my philosophy of care, I'm very, very, very much about empowering my patients and families to be able to take charge of their own health care and to be able to know what's going on with their health, know what's happening with their bodies. So I sent my CV out to a lot of different FQHCs and community health centers in the area because that's the demographic that I knew I wanted to work with. And so Legacy was one of the people who I heard back from. And Denise, who is the physician recruiter, let me know that there was a new position opening up for an adolescent medicine doctor, which was perfect for me. I've always loved adolescent healthcare. I really think that a lot of the issues that they face are just because they don't feel like they have an outlet to be able to talk about these kind of things, or they don't feel comfortable with parents or teachers or anything. So I try to be that one adult. This is a young man who at the time I believe was 17, close to being 18 years old, and was still in the 9th grade. He'd had a lot of issues, legal issues, problems with the police. Also, I believe he had a 1-year-old child at the time, and he wanted to try to work, but he was in the 9th grade, not close to graduating, failing everything. So at some point, I just shut my laptop, looked him straight in the eye, and said, "How much longer do you think you're going to live?" He looked me straight in the eye and said, "Miss, I don't really know." And so for me, that actually changed the way that I practice a little bit, because you can try to address things like asthma and obesity, vaccines, but if the patient or if the child doesn't think they're going to live past 21 years old, then you have to reframe your whole frame of reference and be able to really reach them from where they are, and hopefully be able to help them look past their situation and identify skills, identify things to help build their self-esteem so that they believe that they're worthwhile.